Obviously, you've successfully completed the Let's Get Started section if you're listening to this first lecture. Your assignments focus on getting to know each other by posting your introductions and exploring the Library Media Center, especially the library guides and databases. The syllabus, lesson, and quiz is to ensure you understand the expectations of this course, as well as additional policies and resources available to you as a student. Important note that I want to reiterate. Please do not hesitate to contact me through Canvas email or phone. I have a flexible schedule and I can work with you to meet if you prefer to discuss a topic or issue. I often work remotely, so a virtual meeting may work best to align our schedules. The reading assignment for this week is simply the introduction to the book. I will highlight just a few points from the introduction and share a little of my personal perspective. Before we launch into the quarter, let's take a moment to reflect on healthcare as a service industry. I once heard a senior leader at one of the organizations I worked at share the following evolution of healthcare. When she began her career, the belief was, build it and they will come. It was location, location, location. Organizations spread out to provide service everywhere, local to the community. Next came technology, and buy it and they will come. Money was not an issue, and organizations focused on expanding their technology, such as imaging systems and treatment systems, high-tech operating rooms, etc. Now, it's prove it and they will come. Patient outcomes and satisfaction must be transparent as patients shop for their care. Healthcare is a very complex industry. Care providers often enter the field to care for people and have a very difficult time considering the business side of the industry. Patients must navigate across multiple providers, locations, and payers. Third-party payer systems present challenges for everyone. Throw in government regulations, and it's no wonder we have chaos. Through the quarter, we'll connect the various roles and responsibilities of the healthcare manager with the coursework of the program. Having been in healthcare since the early 80s, I've seen significant changes in my career. Just imagine the changes that have occurred over centuries rather than just a few decades. The delivery of medicine has changed, as have the relationship between the care providers and patients. Technology obviously plays a significant role in change. Imagine back in the 1800s, where the leading cause of death was acute infectious diseases. Fast forward to the conversations today about the risks of vaccinations. Consider the operating room without anesthesia or even understanding germs. Now, we have robotic surgery rooms and providers in another region performing the surgery. Medications have been developed to combat disease and cancer. Life expectancy has increased, and so has the approach to healthcare. No longer is the hospital a place to die, it's a place to heal. We do not just treat symptoms, but we look for the root cause. We do not just treat illnesses, we work to prevent the disease in the first place. You'll still hear the art of medicine. I agree with this to a certain extent in the way the very personal side of medicine is an art. However, we now focus on the science of medicine. Scientific-based medicine relies on proven methods to deliver health care. The role of the government in healthcare has also changed over time and will continue to evolve. It wasn't until after World War II that the U.S. government helped expand the research and access to healthcare. The National Institute of Health, or the NIH, was created to further research. The Hill-Burn Act supported community hospitals and clinics, and employer-purchased health insurance became tax-exempt for employers. As healthcare became more accessible with employer insurance to help cover the cost, life expectancy was increasing due to the advances in technology, etc. Public health programs focused on prevention and lifestyle changes improved the quality of life as one aged. The debate of the role of government in healthcare is still a very hot topic today. What about those that can't afford insurance? Should our behaviors be regulated to protect us from ourselves? Eventually, The government became actively involved mid-1900s in the payment for healthcare services for the poor and elderly through the creation of Medicare and Medicaid. Both grew over the decades. Now, with the baby boomers retiring and life expectancy increasing, the expenses of federal or state-sponsored healthcare programs is under constant debate. Medicare uses the traditional payment mechanism of fee-for-service. This is a retroactive payment structure that pays for the service after it has been provided, regardless of the outcome. It is based on the concept that providers will only order what is necessary, that it is usual, customary, and reasonable. But this also creates an incentive for providers to order more tests, perform more procedures, etc. Costs to Medicare began to rise, along with the increased life expectancy. Medicare then moved to a system that would pay for services related to disease or diagnostic-related groups, DRGs. This is a prospective payment mechanism based on a price established before the treatment. The payment does not vary depending on the resources used to treat the payment. This mechanism has the effect of reducing the number of tests ordered or procedures performed to providers, or healthcare organizations make more money. Managed care builds off the DRG Medicare system. The payer, which is an insurance company or healthcare organization, contracts a defined list of services for a specific list of patients and pays a prearranged payment. The incentive shifts slightly for the provider to keep the patient healthy and not wait for the disease to present. This would hopefully avoid the expense of tests or procedures, and yet the provider is still paid by contract. Taking it a step further, the payer may also require pre-approval before an expensive test or procedure will be paid. When an insurance company puts into place a pre-authorization process for services ordered by the provider, the patient and provider can become very frustrated. Not only is there a delay in care, but the idea that someone else could deny care is hard to accept. The complexity increases with the preferred provider organizations, PPO, and the point of service, POS plans. These plans might limit the approved provider that can be limiting if you have a provider out of network. The plan may include co-payments, deductibles, and co-insurance payments. As a manager, it becomes important to understand the different payment mechanisms for your patient population. You may even become involved in contract negotiations. Imagine trying to negotiate the healthcare industry, imagine trying to navigate the healthcare industry as a patient. As an insider to healthcare, I have helped my family members deal with the very complex system. When one is very ill, the stress of dealing with it all can be overwhelming. Now consider the uninsured and the underinsured people. Access to healthcare is still limited for many. One of my favorite references is the Institute of Medicine's Crossing the Quality Chasm from 2001. A link to both the IOM reports is provided within Canvas. They're free, and both are an interesting read. Although they are over 15 years old, they are both relevant today. One of my favorite concepts presented by our authors is whether we have a true healthcare industry or a disease care industry. These are two very different concepts. Do we create and maintain health, or do we treat disease as it presents? We continue to have debates around the expensive screening tests, such as mammography or PSA tests. We now have genomics to help us identify our risk of disease long before it presents. We do not work within silos in healthcare. We have internal and external partners. There are opportunities and threats. The environment is ever-changing. Conceptual skills will be required to help lead change and develop teams. The concepts of intelligent decision-making is introduced and will be a strong basic process for just about everything you approach as a manager. Interpersonal skills will help you manage the inevitable conflict. Technical skills such as budgets, program assessments, and legal requirements ensure you will be fiscally responsible while maintaining high-quality programs that meet regulatory requirements. You will learn to manage your own time so you can lead by example. During this quarter, you will learn much more about healthcare industry. You'll learn about management theory and explore various leadership styles. If it sounds complex now, not to worry, you will have a chance to learn more about these through the program.